Hey everyone, Dr. Mike here. Today we're talking about syphilis, a disease you might think is history, but it's making a big comeback in 2025. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum, known as the Great Pretender because its symptoms mimic other illnesses. You might ask, why talk about it if it's curable? Because cases are rising worldwide, and untreated syphilis can cause severe, even fatal complications. The good news, it's completely curable, if caught early. Knowledge is your best defense. Understanding how syphilis spreads and what to look for can protect you and your loved ones. Stigma is a huge barrier. Many avoid testing out of embarrassment, which only helps the infection spread. We need to normalize STI conversations. Getting tested should be as routine as a dental checkup. This isn't about fear, it's about empowerment. Syphilis can affect anyone, regardless of age, gender, or orientation. We'll cover how it spreads, its stages, diagnosis, treatment, and prevention. By the end, you'll know why syphilis still matters, and how you can protect yourself. Let's get started. How does syphilis spread? Through direct contact with a syphilis sore, usually during vaginal, anal, or oral sex. These sores are often painless and easy to miss, making the infection easy to pass on without knowing. You can't get syphilis from toilet seats, pools, hugging, or sharing utensils. The bacteria can't survive outside the body. Anyone sexually active is at risk, but rates are higher among men who have sex with men, people with HIV, and those with limited healthcare access. Pregnant people can pass syphilis to their babies, causing serious health problems, so prenatal screening is essential. Prevention starts with facts, not fear. We'll talk more about congenital syphilis soon. Syphilis develops in stages, each with unique symptoms. Primary stage, a painless sore appears where the bacteria entered. Genitals, anus, mouth, it heals on its own but the infection remains. Secondary stage, weeks later you might get a rash often on palms and soles, mouth sores, fever, swollen glands, or fatigue. These symptoms also fade but syphilis persists. Latent stage, no symptoms but the bacteria are still in your body. This stage can last years. Early latent syphilis is still infectious, late latent is less so. Tertiary stage, years later untreated syphilis can damage your heart, brain, nerves, and more. Sometimes permanently. Neurosyphilis and ocular syphilis can cause dementia, paralysis, blindness, or hearing loss. The key message: symptoms may disappear, but the infection doesn't. Early detection is critical. Don't wait for symptoms. Get tested if you're at risk. The earlier you catch it, the easier it is to treat. Untreated syphilis can be devastating. That's why awareness and action matter. Let's look at why congenital syphilis is so serious. Congenital syphilis happens when a pregnant person passes the infection to their baby, often with tragic results. It can cause miscarriage, stillbirth, or severe lifelong health problems for the child, like bone deformities, blindness, or developmental delays. Many babies show no symptoms at birth, so the infection can go unnoticed until it's too late. The solution is simple routine syphilis screening during pregnancy, a quick blood test, and if needed, penicillin treatment can prevent almost all cases. Early prenatal care saves lives and prevents suffering. Protecting babies starts with testing and treating expectant parents. Prevention is possible and essential. Diagnosing syphilis starts with a conversation and a physical exam. If a sore is present, a sample can be checked under a microscope for the bacteria. Most often, diagnosis relies on blood tests. First, a screening test, then a confirmatory test. The first test checks for antibodies your body makes in response to infection. The second confirms it's really syphilis. If there are neurological symptoms, a spinal tap may be needed to check for neurosyphilis. For most people, a simple blood test is all it takes. Early diagnosis means faster, easier treatment. The best news about syphilis: it's curable. Early stages are treated with a single penicillin injection, one shot, and you're cured. Later stages require a series of injections over 3 weeks. If you're allergic to penicillin, alternatives exist, but penicillin is best, especially for pregnant people. After treatment, follow-up blood tests confirm the infection is gone. Make sure your sexual partners get tested and treated too to prevent reinfection. Treatment stops future damage but can't reverse harm already done. Another reason to act early. Open communication and regular testing break the chain of transmission. Don't delay. Early treatment means full recovery. Now, let's talk prevention. Prevention is powerful. Abstinence is the only sure way, but for most, safer sex is key. Use condoms correctly every time. They reduce risk, though not 100%. Be in a mutually monogamous relationship with a tested, STI-free partner. Talk openly about sexual health and get tested together. Make STI screening routine, especially with new or multiple partners. Pregnant? Get tested early and if needed, treated to protect your baby. There's no shame in testing or treatment, only empowerment. Knowledge, safer sex, and honest conversations protect you and others. Early detection saves lives and prevents lifelong harm. Stay informed, get screened, and take charge of your health. HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system, specifically targeting CD4 T cells, the commanders of our internal defense. By destroying these cells, HIV weakens the immune system, leaving the body open to infections it would normally fight off. If untreated, HIV can progress to AIDS, the most advanced stage, where the immune system is severely compromised. Thanks to scientific breakthroughs, HIV is now a manageable chronic condition, not a death sentence. With effective treatment, people living with HIV can lead long, healthy lives. Understanding HIV, its impact, and the progress in treatment is key to fighting stigma and empowering everyone to protect their health. The immune system is a complex network defending us from infections, with CD4 T cells orchestrating the response. HIV's strategy is devastating. It invades the bloodstream, locks onto CD4 cells, and hijacks them to produce more virus. As HIV multiplies, it kills these vital cells, steadily weakening the immune system. Over time, the loss of CD4 cells leaves the body defenseless against infections. This is how HIV causes disease and, if unchecked, leads to AIDS. The virus's ability to dismantle the immune system from within is what makes it so dangerous. Understanding this process highlights why early detection and treatment are so important. HIV infection unfolds in 3 stages: acute infection, clinical latency, and AIDS. The acute stage occurs within weeks of exposure, with high viral load and flu-like symptoms, often mistaken for a common illness. The clinical latency stage can last years with few or no symptoms, but the virus continues to damage the immune system. AIDS is diagnosed when CD4 counts drop very low or certain severe infections develop. Without treatment, AIDS is life-threatening, but many live symptom-free for years without knowing they're infected. Regular HIV testing is essential for early diagnosis and effective treatment. Early detection allows people to start treatment, stay healthy, and prevent transmission. Antiretroviral therapy, or ART, has transformed HIV from a fatal illness to a manageable condition. ART is a combination of medicines that suppress HIV, allowing the immune system to recover. The goal is to reduce the viral load to undetectable levels, preventing further immune damage and halting progression to AIDS. Adherence to daily medication is crucial for success. ART also means that people with undetectable viral loads cannot transmit HIV sexually. Undetectable equals untransmittable, or U equals sign U. With prompt treatment, people with HIV can live long, healthy lives. ART's success is a testament to the power of medical innovation. Preventing HIV is as vital as treating it, and today, we have more options than ever. Condoms remain a simple, effective barrier against HIV and other STIs. PrEP, a daily pill for those at high risk, is up to 99% effective at preventing HIV. PrEP, taken within 72 hours after exposure, can stop infection before it starts. New, long-acting injectables like lenacapavir offer protection with just 2 shots a year, making prevention easier for many. Combining methods like condoms and PrEP offers even greater protection. Education and access to these tools are key to ending new HIV infections. The story of HIV has shifted from fear to hope, thanks to science and advocacy. People with HIV can now live full, vibrant lives, working, traveling, and building families. U equals sign U has helped reduce stigma and empower those living with HIV. Challenges remain: stigma, unequal access to care, and the need for education. Global efforts aim not just to manage HIV but to end the epidemic for good. With early diagnosis, effective treatment, and powerful prevention, the future is brighter than ever. By supporting science and each other, we can finally bring an end to HIV.